Welcome to this month's episode of Parenting Unplugged, Raising Healthy Teen Minds. This episode is particularly timely as Eating Disorders Awareness Week 2025 is approaching later this month. This annual campaign educates the public about the realities of eating disorders and provides hope and visibility to individuals and families impacted by these conditions. We're excited to have Sarah Mulligan with us today. Sarah is a licensed clinical professional counselor for eating disorders at Endeavor Health Behavioral Health. Can you give us an overview of the three most common types of eating disorders?
There are three main different types of eating disorders. The first one, really commonly known, anorexia or anorexia nervosa, really classified by distinct weight loss, being underweight, and restricting food intake. The one key point of this is that not everyone who has anorexia is underweight. Oftentimes you can be in an average sized body and still not be getting enough nutrients. So it really is characterized by mainly not getting enough nutrients, restricting intake to possibly just one meal a day, 2 meals a day, or not eating snacks or restricting certain types of food. Bulimia is characterized by binging and purging. It is a way for people to release the food that is in their body. They will eat an excessive amount of food and then purge it. Some people with bulimia, however, do not experience those episodes of binging to the point where eating excessive amounts of food in a very short period of time, but they may be just purging or throwing up the food that they have eaten in their bodies. And then binge eating disorder is characterized by eating an excessive amount of food or food that than the average person would eat in a short period of time. So for instance, some people with binge eating disorder will eat like 3 or 4 hamburgers, some French fries in a very short period of time, less than 1 to 3 hours in that period of time that someone may eat food in the entire day.
How do these disorders impact the physical and emotional well-being of teens?
For teenagers, they're really resilient. Their bodies are very resilient. So oftentimes the physical manifestations of eating disorders might not show up until the adolescent is well into their eating disorder. Things like fatigue, abnormal labs, cardiac issues. One of them death can also be a medical complication for eating disorders. It is a leading cause of death, second to opioid addiction for adolescents, and it can really get to that extreme. And before it gets to that extreme, we'll see things like being very fatigued, being very tired, brain fog. One of the things a lot of times parents say is they're just not focusing as much at school. They don't seem to be as involved. They might be wanting to sleep more. And those other kind of challenges, emotional challenges, increased anxiety, increased irritability, being hangry is definitely a thing. Understanding that when we don't get enough nutrients, we might be irritable. And also just being emotional sometimes, or sometimes being emotionally stunted. When we aren't getting enough nutrients, our ability to process our emotions isn't quite the same. So you might see your adolescents being more withdrawn, wanting to stay to themselves, not wanting to be around you. They also will have often obsessive and ruminating thoughts about food, their weight, their body. And oftentimes in these patients that we see, a lot of perfectionism. They just want things to be perfect. You might see them redoing their notes. They might be school notes. They might want to have everything around them be perfect and in order. Eating disorders are really about control. So it isn't just about controlling what they eat, but it's also about controlling their environment.
Are there any lesser-known eating disorders, such as ARFID or Orthorexia, that parents should be aware of?
There are other lesser known eating disorders out there that aren't necessarily fully diagnosed. For instance, orthorexia. It is not in the DSM, but it is what we're seeing a lot in adolescents and individuals with the emergence of social media and diet culture and all these things. Like TikTok especially, there's a lot of people that are hearing things like, you shouldn't eat this, you shouldn't do this. Orthorexia is a high focus, overwhelming focus on eating clean, eating health foods, eating foods that are good for you without the understanding that we can make all foods fit. But orthorexia really does focus on those health foods. But where it becomes a problem is when your food world becomes so small. Think, if your adolescent will only eat organic food and that's all they'll eat, how many restaurants serve just organic food? They'll stop going out with their friends. Food is very social. They might not hang out. They might not go places. They might make excuses. And so that can lead to a lot of smaller food world, which then leads to smaller social gatherings, not wanting to eat food at friends' house, not wanting to eat food for the holidays, things like that, and trying to really measure all your foods, making sure you're just getting certain clean eating foods, which are really out there. And at the forefront, it seems healthy. But as you go forward, if it makes your food world smaller, it can become scary. And it's this unhealthy, overwhelming focus on eating clean, eating well, eating health foods, all of those things. ARFID, otherwise known as avoidant restrictive food disorder, is a disorder of textures, tastes, smells of foods. The looks of them, different colored foods, foods touching. This often shows up for individuals who are on the autism spectrum or have had some sort of traumatic experience around foods. They are extreme picky eaters. This isn't just a kid who won't eat peas or broccoli, but it might be a kid who won't eat any vegetable at all, or might be a kid who will only eat brown foods, will only eat, light colored foods, those sorts of things. It kind of shows up in different types of textures of foods.
What are some warning signs that parents should look out for in their teens?
The thing about eating disorders is that oftentimes they're really hidden. They're very secretive. And so one of the warning signs that I like to talk to parents about first is just avoidance. Avoidance and withdrawal. Avoiding family meal times, making excuses, saying things like, I'm not going to eat dinner with you. I'm going to eat dinner with my friends. And then you might find out later they didn't eat with their friends because they told their friends they ate dinner at home. Avoiding family gatherings where there might be food, saying they're not hungry, throwing away food. And then on the flip side, staying awake all night, eating a lot of food all at once, spending excessive amounts of time in the bathroom, whether that be body checking or taking time to purge, not really knowing or hearing what they're doing. Wearing baggy clothes can be a really big warning sign. A lot of times we see people in treatment who don't come to treatment until the summertime when adolescents are starting to wear less clothes, shorts and tank tops and things. And then all of a sudden you're seeing the weight loss that happens. Excessively exercising is really also a warning sign. So while movement is healthy and it is oftentimes a socially acceptable way of doing things, we're seeing kids who are in the gym for hours, maybe taking time in the morning before school, then doing a sport and taking that time even after their sport. Sometimes we've seen kids who are exercising to the point of stress fractures and running, but still wanting to run, feeling a withdrawal from this working out. If you're told, let's not work out, they're feeling like an excessive compulsion to work out. I must work out, even if they're sick. Seeing those sudden weight changes for sure. I know I said earlier that people in an average size body can still have anorexia and still be malnourished. But the excessive weight loss is definitely something to look for. The emotional symptoms like being irritable, snippy, and also emotionally withdrawn, being really hyper-focused on getting things right, being perfect, and also just this preoccupation with appearance. Also might want to not go to the store to try on clothes, might want to avoid interactions where they have to wear nice clothes or wear different clothes, always wanting to maybe always change their outfit before they leave the house.
How can parents differentiate between typical teenage behavior and red flags for an eating disorder?
So parents can really start by observing, asking questions, discussing what's going on, having those family interactions. Maybe saying, hey, I've noticed that you've been talking negatively about your body, which is another warning sign, those excessive negative comments about bodies. Well, I hear a lot of parents say, aren't negative body image issues part of being adolescent? Yes, absolutely. However, if these things become, they don't like their bodies, so they're not going out. They don't like their bodies, so they're skipping a meal. They may see their weight at the doctor's office and they now don't want to eat dessert ever again. Really checking to make sure what's in recipes. Just asking questions, looking at the consistency over time, creating an environment where we can have conversations and open conversations about, hey, what are you feeling? Hey, I've noticed. Don't accuse, don't say, hey, you're not eating, do you have an eating disorder? But say things like, are you okay? I've noticed that, you haven't been eating with the family. You've been wanting to go to your room. I've noticed that you haven't used your lunch money, things like that. Or you're talking very negatively about yourself. Can you tell me what's going on? Do you need to talk about it? Creating an environment where you can have a conversation. Patterns over time could be a problem. Also, irritability, being withdrawn, all of those things are also part of being a teenager. So it is asking questions and putting them together. If it's excessive, excessive worry about body, excessive withdrawn, and being withdrawn around meal times. Those things maybe start to ask different questions or seek additional resources.
How can other professionals help identify these issues during routine interactions?
Lots of different professions are going to come in contact with individuals with eating disorders: doctors, dentists, school counselors, other therapists. Really making sure that they're watching out for and knowing these warning signs too. Oftentimes at school counselors may get told by other students, hey, so and so isn't eating, or coaches may notice that there is an excessive focus on body performance and not eating certain foods. So really addressing those in a safe way. Also understanding that, especially in the school system, some kids might gossip, might say things. Just because someone's underweight doesn't mean they have an eating disorder. So really talking to that student, asking the questions. Therapists too, asking the questions. If you have a patient who is talking about low self-esteem, asking about food, asking about meals. Is this affecting your eating? Is this affecting how you interact with others in your world, how you feel about your body? Asking those questions and just creating an open environment.
What immediate steps should parents take if they suspect their child has an eating disorder?
Approaching it with empathy, with kindness, with asking questions, but also sometimes with firmness. Hey, I've noticed that you've lost a lot of weight. I've noticed that you're not eating with us at all. I'm really concerned as a parent. Talking to that from concern versus anger. What I know about parents and working with families is that it's scary. Eating disorders are scary. We know that eating disorders can kill people. So sometimes fear can manifest as anger as parents, which is understandable. But making sure that you're checking that and giving the empathy and concern, making sure that you're consulting with those professionals, getting an assessment, really making sure that you know where your resources are and knowing how to get the help that you need. Seeing a therapist, getting an assessment, really those things are important.
Can you share some resources that parents can turn to for help?
The first one nationally is the National Eating Disorder Association, or NEDA. They offer a lot of support for parents, a lot of support for patients as well. They have virtual support groups. You can log on, you can find in person support groups and find places to go to be able to find help. Also, getting those specialized services that we offer here in Deborah Health Behavioral Health Services, whether it be outpatient therapy or HP and IOP or inpatient services for those level of care, to be able to get their child in for an assessment, to call the assessment number and see what level of care they might need if they have those types of concerns.
What does the treatment process typically look like for teens with eating disorders?
So there are multiple levels of care for eating disorder treatment, from inpatient services, PHP, IOP, residential services, and also outpatient therapy. It is really important to understand that depending on where your child is in terms of need, they can really fluctuate between the different levels of care. So we can go through those real quick. So inpatient level of care is immediate stabilization when there is a crisis, when those behaviors need to be stabilized. There is also medical stabilization that can also happen as part of this that may require the medical hospital intervention as well. If the malnutrition is so bad, labs, hearts, blood sugars, those sorts of things, the medical hospital can get involved. And then there's an inpatient level of care that really is stabilization to stop the behaviors, to restore some weight, and then move a patient on either to outpatient IOP or possibly residential services. Residential services is a longer term stay, 24 care that can be longer term for patients that really do need the extra support, that maybe just going home after inpatient may not be the right level of support. HP, partial hospitalization program, is another level of care. They're doing programming. It's a group-based program. They're seeing an individual therapist. They're seeing a dietitian. Linden Oaks HP right now is doing cognitive behavioral therapy, enhanced cognitive behavioral therapy, or CBTE, to address the maintaining factors of the eating disorder. And in that PHP and IOP program, they're really diving into those systems. They can be in program for 8 weeks and sometimes more than that, to really focus on those things that are maintaining, that are keeping the patient stuck in their eating disorder. It also, during that time, they are seeing a multidisciplinary team, which is really important to the treatment of an eating disorder. There is a medical provider, there is a dietitian, there's a therapist. there's a nurse, and then there are other mental health professionals that are helping your child throughout the day in PHP and IOP programming. Within that programming, the importance of family involvement is really part of that too.
You mentioned family involvement. What are some other ways families can support their child during treatment and recovery? And how can they support their teen through setbacks?
The family is a very important part of the treatment team. The patient is part of the treatment team, the therapist, the dietitian, the medical professionals, all part of the treatment team, and also the family. We cannot do treatment often without the family involvement. The patients are going home, they're being part of the system at home. The family really needs to be bought in to helping their child. It is really important to ask the right questions or ask the questions, get the information, and really show that your child that you're involved and you're willing to help.
Thank you, Sarah, for sharing your expertise and insights on this important topic of eating disorders.
Thank you so much for having me.
For our listeners, remember that you're not alone. Resources like the National Eating Disorders Association and the specialized programs at Endeavor Health Behavioral Health are available to support you. We appreciate you tuning into this episode of Parenting Unplugged, and join us next month as we explore another crucial topic, social media and its impact on parenting.